Hey everyone, welcome back. Today we're going deep on erectile dysfunction.
ED.
Yeah, ED, using some really interesting sources.
Absolutely.
We've got the latest guidelines from the American Urological Association.
These AUA.
Yep, the AUA. And we've also got this thought-provoking editorial by Dr. Praveen Ramachandra. So we're going to break down all that medical jargon, all that complicated stuff, and get straight to what you need to know.
Straight to the good stuff.
Exactly. So one thing that really stood out to me was how both these sources approach ED. They really emphasize that it's more than just a physical issue.
It really is. You hit the nail on the head there.
So the AUA, they actually define ED as consistent difficulty getting or maintaining an erection that's good enough for satisfactory sex.
That's a good definition. Really comprehensive.
I know, right? And that word satisfactory, that's key.
Oh, absolutely, because it acknowledges that it's about the individual's experience.
Totally. But here's the thing that kind of blew my mind. The AUA guidelines, they call ED a risk marker.
Yeah, a risk marker. It's like a canary in a coal mine.
A canary in a coal mine. I like that.
It can be an early warning sign for other health conditions, especially cardiovascular disease.
Whoa, okay. Seriously. So it's not just about, your sex life. It could be a red flag for your heart.
Exactly. If your blood vessels aren't healthy enough to support an erection, there's a chance they're not doing so well in other parts of your body either.
Wow, that's scary.
It is, which is why the AUA, they recommend a really thorough medical checkup if you're experiencing ED.
Okay, that makes sense.
They want to rule out any underlying issues.
Right, like low testosterone or something like that.
Exactly.
So that's step one, knowing that it could be more than just ED. But what about treatment? I bet a lot of people just think Viagra.
Oh, yeah, for sure.
That's not the answer. Just pop a pill.
Well, oral medications like Viagra or sildenafil, they're definitely an option.
Sildenafil, that's the generic name, right?
Yep, that's it. They're called PDE5 inhibitors.
PDE5 inhibitors, okay.
And they're generally, pretty effective.
Okay, good to know.
But here's something that people might not know. They don't work so well if you're also taking nitrates.
Nitrates.
Yeah, for heart conditions.
Oh, interesting. So you got to be careful with those interactions.
Definitely talk to your doctor about any other medications you're on.
Okay, that's good advice. But what if the oral meds just aren't right for you? What then?
Well, that's where things get interesting.
Oh.
The AUA guidelines, they actually outline this whole range of treatment options. It's like a buffet.
A buffet of ED treatments.
You and your doctor can, figure out what works best for you together.
Okay, I love that. A buffet of options.
Yeah.
So let's start with, the least invasive stuff.
All right, sounds good.
What do we got?
Well, lifestyle changes are always a good place to start.
Yeah, you hear that a lot, right?
Yeah.
Eat healthy, exercise, all that.
Yep. And they might not be a cure-all.
Right.
But a healthy diet and regular exercise, it can improve erectile function.
Even if it's a small improvement, that's still something.
Exactly. Plus, those healthy habits, they're good for your overall health.
It's a win-win.
Exactly.
Well, what if those changes aren't enough? What's next on the buffet?
Well, then we move on to other options.
Like what? Give me the good stuff.
There are vacuum erection devices, or VEDs for short.
DEDs? I've heard of those. Aren't those a bit awkward?
Some men find them a bit awkward, yeah.
Okay.
But they're actually quite effective,
Mm-hmm.
and they're a less expensive option.
Okay, so that's good. Any downsides?
Some men do experience discomfort.
Oh.
Or, they might have trouble with ejaculation while using them.
Okay, good to know. So it's an option, but maybe not for everyone.
Right. There's also intraurethral alprostadil.
Intra what?
Intraurethral alprostadil. That's it's a medication you insert into the urethra.
Whoa, okay. That sounds a little intense.
It's not for everyone,
Imagine.
but it's a good alternative for men who can't take oral medications.
Okay, so more options for people who can't do the pills.
Exactly. And then there are intracavernosal injections, or ICI.
ICI, okay.
Where medication is injected directly into the penis.
All right, starting to get a little out of my comfort zone here.
Yeah, this is getting a little more involved.
What's the most extreme option?
Well, for men who haven't had success with the other treatments, there's penile prosthesis implantation.
Okay, so that's a surgical procedure.
It is. It's a surgery.
Makes sense.
Yeah.
So there's a lot to think about, different options depending on your situation and what you're comfortable with.
Exactly. It's all about finding what works best for you.
Now, we've been talking about the physical side of things.
Right.
But it's not just about that, right? Dr. Ramachandra's editorial, he really digs into the psychological impact of ED.
Oh, absolutely. The mind plays a huge role in this.
I can see how that would be a vicious cycle, you know?
Yeah.
You're worried about performing, which makes you anxious, and then that makes it even harder to.
Yeah, exactly. It's like a self-fulfilling prophecy. That's why the AUA guidelines really recommend therapy and counseling.
So it's about addressing those mental blocks that might be contributing to the ED.
Precisely. Dr. Ramachandra calls it a holistic approach,
I like that.
acknowledging that the mind and body are completely interconnected.
Yeah, it makes sense.
Sometimes just talking about it can make a big difference.
That's really encouraging. It's great that they acknowledge that therapy can be helpful. It shows that they're looking at the whole person.
Exactly. It's not just about treating the symptom.
Right. Now, you mentioned Dr. Ramachandra, and I remember he was actually pretty optimistic about the future of ED treatment.
Oh, he was. He's really excited about some of the potential breakthroughs.
Like what? Give me some hope here.
He thinks there's huge potential in, molecular biology and regenerative medicine.
Okay, those are some big words.
They are, but imagine things like gene therapy or tissue engineering.
Wow. Gene therapy for ED.
It could completely revolutionize how we approach ED.
That's incredible. It sounds like this field is constantly evolving.
Oh, it is. There's always something new on the horizon.
That's really exciting. So there's definitely hope for even more effective and personalized treatments down the road.
Absolutely. And it's important to stay informed about all the latest advancements.
All right, so we've covered a lot of ground here, from understanding what ED really is to all the treatment options and, the importance of addressing the psychological side of things.
It's a multifaceted issue for sure.
It is. But let's get a little more specific about some of those treatments.
Yeah, let's dive a little deeper.
And how they might apply to different situations. Sound good?
Sounds great. Let's do it. It's interesting how ED treatment can look different, depending on your personal health journey.
Oh, yeah, for
For
sure.
instance, for men who've had prostate cancer treatment, managing expectations is key.
That makes sense.
The AUA guidelines actually point out that using PDE5 inhibitors, like Viagra or Cialis,
Right.
immediately after a prostatectomy or radiation might not, bring back spontaneous erections right away.
Oh, that's interesting.
Yeah.
I could see if someone might be disappointed if they thought those medications were just like a quick fix.
Right. It's not about instant results.
Right.
It's more about, assisting with erections on demand during the recovery period.
Okay.
Most studies show that PDE5 inhibitors can be helpful for that.
So it's more about managing expectations and understanding that full recovery takes time.
Exactly.
What else do the guidelines highlight for men in that situation?
Well, beyond the physical aspects, they really emphasize the need for psychosocial support.
Okay.
Prostate cancer treatment is a huge life event, both physically and emotionally.
Yeah.
Addressing the potential impact on sexual function is crucial.
Makes sense.
Yeah, it's not just about the physical healing, but the emotional and mental aspects as well.
Right, the whole package.
Exactly. And the AUA recommends that doctors, have those open and honest conversations with their patients, explaining the potential sexual side effects of these treatments and, helping them set realistic expectations for recovery.
So important, that communication.
It is.
It's all about clear communication and support.
Absolutely.
Now, switching gears a bit, what about men dealing with both ED and low testosterone? What do the guidelines say about that combination?
They recommend a combined approach in those cases,
Okay.
using PDE5 inhibitors along with testosterone therapy.
Okay, so it's like addressing both sides of the coin.
Exactly. It's about addressing both the hormonal and physical sides of ED.
So it's like a two-pronged attack.
Right.
Does that mean that testosterone therapy on its own isn't effective for ED?
That's an important point.
Okay,
Testosterone therapy alone isn't a solution for ED.
got it.
It needs to be part of a comprehensive approach that addresses all the factors involved.
It's all about finding the right balance for each individual then.
It is.
Now, I want to circle back to those vacuum erection devices, or VEDs,
VEDs, yeah.
that we talked about earlier.
Right.
They seem to be a popular option, but what are the potential drawbacks?
Well, as you mentioned before, some men find them a bit awkward or uncomfortable to use,
Right.
and there can be some difficulty with ejaculation while using a VED.
Okay, so it's not a perfect solution for everyone,
Mm-hmm.
but it's good to have options.
Exactly. There are a lot of options out there.
What about intraurethral or prostadil? That sounds like a less common treatment.
It is, but it can be a good alternative for men who either can't take oral medications or simply prefer not to.
Okay.
Mm-hmm.
And remind me, how does that one work again?
It involves inserting a tiny medication pellet directly into the urethra.
Okay, so that's an option for those who might not tolerate the pills.
Right.
And then, of course, we have the intracavernosal injections, or ICI.
Yes,
And-
ICI is highly effective.
Okay,
But the guidelines stress the importance of proper training from a healthcare professional.
right.
It's not something you want to try on your own.
Definitely sounds like expert guidance is essential there. And then we have penile prosthesis implantation, which is a more permanent solution
Right.
surgically.
Exactly. It's often reserved for men who haven't found success with other treatments.
Yeah.
It has high satisfaction rates, but it's important to weigh the risks and benefits of any surgery carefully.
It's a big decision for sure.
It is.
So as we've seen, there's a whole range of treatment options out there, each with its own pros and cons. The key is finding what works best for each individual.
Absolutely. And the AUA really emphasizes the importance of shared decision-making between the patient and the doctor.
It's about having those open and honest conversations
It is.
to determine the most appropriate course of action.
Working as a team.
It's about working as a team.
Mhm.
Now, I'm curious about what the future holds for ED treatment.
Future.
Are there any new developments on the horizon?
There are actually some pretty exciting developments in the research pipeline right now.
Oh. Tell me more.
One that's generating a lot of buzz is low-intensity extracorporeal shockwave therapy.
Shockwave therapy. That sounds intense.
It does, right?
How does that work for ED?
It might sound a bit sci-fi, but it basically involves using sound waves to stimulate tissue regeneration in the penis.
Wow, so it's like jump-starting the body's natural healing process.
Exactly.
Is it effective?
It's showing some promise, but the research is still ongoing.
Okay,
We need more long-term data to confirm its effectiveness and safety.
so it's one to watch.
Definitely.
What other innovations are being explored?
Another fascinating area is stem cell therapy.
Oh, wow.
Researchers are looking into injecting stem cells directly into the penis to promote tissue repair.
Stem cells are so fascinating.
They are.
It seems like they hold so much potential for so many different areas of medicine.
They really do.
It's incredible.
And then there's platelet-rich plasma therapy, or PRP.
POP, that rings a bell.
Yes!
Isn't that used for other things like joint pain?
It is.
Interesting.
It involves taking a concentrated solution of platelets from the patient's own blood and injecting it into the area that needs healing. In the case of ED, it's thought that those platelets could stimulate tissue growth and repair in the penis.
So it's harnessing the body's own healing power.
Exactly.
That's pretty remarkable.
It is.
So many different approaches.
There are.
Wow.
The takeaway here is that the field of sexual health is incredibly dynamic.
Yeah.
What's considered experimental today might become the standard of care tomorrow.
It's exciting to think about the possibilities.
It is.
But for now, I want to shift our focus back to the importance of a comprehensive approach to ED management.
Okay.
We've touched on it throughout this deep dive, but I think it's worth emphasizing again.
Absolutely.
The AUA makes it very clear that it's not just about addressing the physical symptoms of ED.
Right.
It's about understanding the whole person,
The whole person.
their physical health, their mental and emotional state, and their relationships.
It's about treating the man, not just the erection.
So it's about treating the man, not just the erection.
Exactly.
I like that.
And Dr. Ramachandra really drives this point home in his editorial. He stresses that successful ED treatment should go beyond just the physical.
Okay.
It should also involve exploring and addressing any underlying psychological or relationship issues that might be playing a role.
Which is why therapy can be such a valuable part of the treatment plan.
Exactly. The AUA actually recommends that doctors consider referring men with ED to mental health professionals, like therapists or counselors.
Especially for men who are dealing with things like anxiety, performance pressure, or relationship difficulties.
Right. Those factors can significantly impact a man's experience with ED.
Of course.
The guidelines also highlight the importance of patient education and counseling.
So it's not just about giving someone a prescription and sending them on their way.
Right. It's about empowering them with knowledge and support.
It's about ensuring that men have the information they need to make informed decisions about their health.
Yes, and to feel confident in their treatment plan.
It's about feeling empowered.
Absolutely.
So let's dive a little deeper into the types of counseling and support that can be beneficial for men with ED.
Okay.
What are some specific examples?
Well, cognitive behavioral therapy, or CBT, is often recommended.
CBT, I've heard of that, but how does it apply to ED?
It's incredibly effective for addressing the psychological aspects of ED.
Okay.
It helps people identify and modify negative thought patterns and behaviors that contribute to their anxiety or performance pressure.
So it's about changing those negative thought loops that can sabotage a man's confidence and affect his ability to perform.
Exactly. It's about reframing those thoughts and developing healthier coping mechanisms.
That makes a lot of sense.
Yeah.
What about couples therapy? How can that be helpful?
Couples therapy can be incredibly beneficial for couples who are struggling with relationship issues that might be contributing to ED.
I can see how communication issues or unresolved conflicts could impact a couple's sexual intimacy.
Absolutely. Couples therapy provides a safe and supportive environment for couples to communicate openly and honestly about their needs and concerns.
So it's about strengthening communication and building intimacy, which can then have a positive impact on sexual function.
Right. And couples therapy can also help partners understand and cope with the emotional and practical challenges of ED, fostering greater empathy and support within the relationship.
It's about facing those challenges together as a team.
Exactly.
Now, what about underlying medical conditions? We've talked about how they can contribute to ED, but how do the guidelines address that?
The AUA is very clear that it's crucial to identify and manage any underlying medical conditions that could be playing a role in a man's ED.
Right.
We're talking about things like diabetes, heart disease, high blood pressure, and high cholesterol.
Right. Those are all serious conditions that need to be addressed anyway.
They are.
But it's good to know that managing them effectively could also improve sexual function.
Exactly. It's a win-win.
It is.
And the AUA stresses the importance of collaboration between the doctor and the patient to develop a comprehensive treatment plan that addresses both the ED and any underlying health issues.
It's all about teamwork and a holistic approach.
It is.
Now let's talk about the role of communication in managing ED.
Communication.
We've touched on it a bit, but I think it deserves more attention.
I completely agree. Open and honest communication is absolutely paramount, both between the man and his doctor and between the man and his partner.
Why is that communication so crucial?
Well, on the one hand, clear communication with your doctor ensures that you get a thorough evaluation, an accurate diagnosis, and a personalized treatment plan that aligns with your needs and goals.
So it's about feeling comfortable asking questions and expressing your concerns.
Exactly. It's about being an active participant in your own healthcare.
What about communication with your partner? Why is that so important?
Communication with your partner is essential for building understanding, empathy, and support. ED can be a challenging experience for both partners, and open communication can help you navigate those challenges together.
It's about breaking down the stigma and creating a safe space to talk about your feelings and concerns.
Exactly, and open communication can help couples work through the emotional and practical aspects of ED, strengthening their bond and intimacy despite the physical difficulties.
It's about remembering that you're in this together.
You are.
Now, the AUA guidelines also talk about setting realistic expectations when it comes to ED treatment.
Expectations are so important.
Can you elaborate on that?
Of course, it's important to remember that there's no magic bullet for ED.
Right.
What works for one man might not work for another.
Right.
And finding the right treatment often involves some trial and error.
So it's not about instant gratification.
Yeah.
It's about understanding that it might take some time and experimentation to find the best approach.
Exactly. Patience and persistence are key. It's important not to get discouraged if results aren't immediate.
Right.
ED treatment often takes time and effort, and working closely with your doctor to adjust your treatment plan as needed is crucial.
It's about staying positive and committed to the process.
Absolutely.
Now let's bring it back to those lifestyle factors we discussed earlier.
Lifestyle.
How do they fit into the bigger picture of ED management?
The AUA is very clear that lifestyle modifications can play a significant role in both preventing and managing ED.
So we're talking about things like quitting smoking, reducing alcohol intake, getting regular exercise, and eating a healthy diet.
Exactly. Those lifestyle changes not only benefit your overall health, but can also directly impact your sexual function.
So it's another example of that holistic approach.
It is.
It's about taking care of your entire well-being, not just focusing on one specific symptom.
Right. And the AUA encourages doctors to talk to their patients about the benefits of these lifestyle changes and to provide support and resources to help them make lasting changes.
It's about making those healthy choices a part of your everyday life. Now, before we move on, I want to touch on one more important point that's woven throughout the AUA guidelines, the idea of ongoing care and monitoring.
That's a crucial aspect of successful ED management.
It is.
It's not about a one-time visit to the doctor. It's about establishing a relationship with a healthcare provider who can monitor your progress over time and adjust your treatment plan as needed.
So it's about having that ongoing support and guidance as you navigate your journey with ED.
Exactly. It's about knowing that you're not alone in this. There are experts who can help you every step of the way.
That's a reassuring message.
It is.
And speaking of reassuring messages, I want to bring us back to that powerful quote from Dr. Ramachandra that we mentioned earlier.
Okay.
He said, "In the quest for health, sometimes the path starts with the most personal symptoms." What do you think he meant by that?
I think he was highlighting the fact that ED, while a deeply personal and often sensitive issue, can actually be a catalyst for positive change in a man's life.
Hmm.
It can be the thing that motivates him to prioritize his health and well-being in a way he might not have otherwise.
So it's about seeing ED not just as a problem to be fixed, but as an opportunity for growth and transformation.
Exactly, and that's a powerful message.
It is.
By addressing ED head-on, men can not only improve their sexual function, but also potentially enhance their overall quality of life in countless ways.
It's about embracing the journey and knowing that there's support available every step of the way.
Absolutely.
Okay, so we're back. And, after diving deep into all the science and the psychology of ED, I want to bring it back to something really important, the human element.
Absolutely.
Because at the end of the day, it's about people's lives.
It is.
And one thing that really stood out to me, both in those AUA guidelines and in Dr. Ramachandra's editorial, was the focus on treating each man as an individual.
Right. It's not a one-size-fits-all kind of thing.
Exactly. Because every guy's experience with ED is going to be different, right?
Absolutely. And their treatment should reflect that.
So that's where this idea of shared decision-making comes in.
Yes. The AUA really emphasizes that.
The doctor and the patient working together like a team.
A partnership.
I like that. So it's not just the doctor saying, here's what you're going to do. It's a conversation.
Exactly. Open communication, collaboration.
So the guy actually has a say in what his treatment looks like.
Absolutely. Talking about the options, the risks and benefits.
Right. And figuring out what matters most to that individual.
What are his goals? What's he comfortable with?
It's about empowering men to take an active role in their own health care.
I love that.
Me too. And it's not just about the medical stuff either, right?
Right.
The guidelines also talk about being sensitive to the emotional and social impact of ED.
Because it's so much more than just a physical condition.
It affects guys' self-esteem, his relationships, his whole sense of well-being.
Exactly. It's all connected.
And you can really see that holistic approach in how the AUA talks about managing the different treatments too.
Oh, absolutely. It's woven throughout the recommendations.
Can you give me an example? How does that play out in practice?
Sure. Take oral medications, for instance, like Viagra or Cialis.
Okay, the popular ones.
Yeah. The guidelines really emphasize, proper instruction, making sure the guy knows how to use it correctly.
Okay, so it's not just here's the pills, good luck.
No. It's about explaining everything.
Right.
And then dose titration.
Dose what?
Titration. It means finding the right dose that works best for that individual.
Oh, okay, so starting slow and adjusting as needed.
Exactly. Personalized care.
I like that. What about some of those other treatments, like the vacuum erection devices?
VEDs.
Yeah, the VEDs. Or those injections.
The intracavernosal injections.
Yeah, those can be kind of intimidating, I imagine.
They can be for some men, so the guidelines really highlight the importance of, hands-on training.
Oh, that makes sense.
Making sure the guy feels comfortable, that he knows what he's doing.
Right, because you don't want to mess around with that stuff.
Exactly. And even with the penile prosthesis, the surgical option, they talk about preoperative counseling, setting realistic expectations.
No surprises.
Right. Making sure the man and his partner understand what to expect, that they're both on board.
It's really all about that teamwork, that open communication.
It is. And beyond the specific recommendations, they also have these general principles for ED care.
Kind of like the guiding philosophy.
Exactly. Yeah.
What are some of the key principles that stood out to you?
Well, one is continuity of care.
Continuity of care. What does that mean?
It means that guys should have ongoing access to their healthcare provider.
Okay.
Someone who can monitor their progress, make adjustments to their treatment if needed.
So it's not just a one-and-done kind of thing. You have someone who's there with you along the way.
Exactly. It's a journey.
And you need a good guide.
You do. Another important principle is patient education and support.
That's huge. Knowledge is power, especially when it comes to your health.
Absolutely. Giving men reliable information about ED, about their options, about lifestyle changes they can make.
It's about empowering them to take control.
Exactly. Yeah.
Now, as we wrap up this whole deep dive on ED, I keep coming back to that quote from Dr. Ramachandra.
The one about the personal symptoms.
Yeah. In the quest for health, sometimes the path starts with the most personal symptoms. It's really powerful.
It is, because ED, even though it's so personal, so sensitive for a lot of guys,
Right.
it can actually be a turning point.
A catalyst for change.
Exactly. It can motivate a man to really prioritize his health, both physically and emotionally,
To reach out for support.
to take care of himself.
And as we've learned, there's so much support available.
There is.
Effective treatments, therapies, a whole community of experts who are ready to help.
If you're struggling with ED, you are not alone.
That's such an important message. So to everyone listening out there, if you're dealing with ED, don't hesitate to reach out.
Take that first step.
There's help available, and there's hope for a healthier, more fulfilling life.
Absolutely.
That's it for our deep dive on erectile dysfunction.
It's been a great conversation.
It has.